Peter Ginman is a vet who lives and works in Herefordshire in the west of England. What made you decide to become a vet?
I was always interested in animals, and originally when I was at school I was hoping to become a zoologist. I wanted to study animals and their behaviour, and because my father was working at a university at the time, I said to him, do you know anybody there that I can go and talk to in the zoology department? And he arranged for me to meet the professor of zoology. And I went to the university and he said to me, do you want to teach? I said, no, I don't think I do. He said, well, 80% of the people who do the zoology course teach. Have you ever thought of being a vet? Oh, I thought that's a rather good idea.
Do you prefer treating farm animals or pets?
Personally, I do probably a little bit more with the farm work, but I don't mind. I like treating them all. I like being involved in them all. And I'm in general practice, so I don't have a specialisation in one particular species or one particular discipline within that.
So why do you tend to prefer farm animals?
I quite like meeting the people in the farm. I'm living in the countryside where we are today in this surgery. We're right in a little village in the countryside on the border of England and Wales. And if you look around and look out there, you'd understand why it's nice to be able to go around and drive around a bit of that country, see the animals there.
What's the most difficult animal to treat?
It's surprising what people turn up with in the surgery. So sometimes, most of the animals that we would see belong to a certain groups. They're dogs, cats, maybe rabbits, guinea pigs, hamsters, ferrets. But now we're starting to see camelids. That is llamas. Certainly we've got llamas locally and other members of that same group. Those suddenly present a challenge because you're looking at an animal that you haven't really dealt with, and he's different because every species is different. Even within a species, we sometimes variations between breeds. So the most difficult is really just one that you're not used to, and you suddenly find yourself thinking, what are the peculiarities? What's the anatomy? What's the anatomical variation? How will particular medicines react? What is the dosage? And you sincerely hope that either you've got a book or there's something somewhere or somebody you can ring up and find out. But I can assure you that when somebody brought a tarantula spider in one day, I did have a moment there where I thought to myself, now, what are we going to do with that? It's the dreaded cardboard box. Somebody comes in with a little cardboard box and they put it down very proudly on the table, and you're waiting in expectation, and then they open it up and you look at it and go, ah, very interesting. Now, what is that?
What do you think is the most intelligent animal of all the ones you treat?
I suppose when we're dealing with intelligence, it's a question you can have intelligent animals within a particular species. So I've met some extremely intelligent dogs, particularly collies, working collies. They are amazing at how they get the sheep in, how they sort them out, or work with the cattle. Marvellous. People always say pigs are very intelligent, and I had a professor at college who always maintained that why do we keep dogs and cats? We should keep pigs as pets. He reckoned they were very clean and they were wonderful animals to have as a pet, highly intelligent.
What's the best and worst thing about your job?
I think the best is always birth. It doesn't matter what species, birth is brilliant, amazing. Every time it happens, one marvels at it, whatever the species. I suppose the worst is always having to put an animal down, put it to sleep.
How do you feel about animals being used in experiments?
Well, the whole principle of using animals in experiments has been reviewed, certainly in this country, very, very strongly, and the principle has been to try to reduce the number of animals used. Now, unfortunately, there seems to be no other way of achieving always the result that we require in testing a particular substance. I do find myself a little bit uncomfortable with the wish that there is to test substances other than medicines. But when we start to get testing cosmetics and things that are somewhat ephemeral in the needs of the human population, I'm not sure that's a good use of animals.
How do you feel about people having large, dangerous dogs as pets?
All dogs can be dangerous. If you look at where deaths have occurred in babies and small children, it's surprising. Sometimes it's been very small dogs that have been involved. It hasn't always been the big dogs. Unfortunately, it's not really the dog's problem and fault. It's usually the owner's problem and fault. And so if the owner can't restrain, keep control, have a proper care of that animal, then any dog can become more dangerous. And the principle of leaving children with dogs is one that should not on any occasion occur, no matter how good anybody believes a particular dog is. Dogs can be dangerous.
You're a star, aren't you? Mm-hmm.
Are there any animals or insects you're afraid of?
I suppose that afraid is one word, being extremely cautious of is another. I've been attacked by cows, not uncommonly, unfortunately, over the years, picked up and thrown across the room, and so on. Now, everybody thinks cows are rather nice creatures and so on, but when they've got a calf at foot, they are very protective and they can be extremely dangerous. A sow with its piglets will be very dangerous and possibly one of the most dangerous species that we deal with. I've treated tigers, I've treated chimpanzees, and in their own rights, those are extremely dangerous. So I think it's a question of assessing the animal, the risk, and taking the suitable precautions, because sometimes it's the small ones that bite you when you're not thinking about it, rather than the big one that you were watching and thinking was going to be dangerous.
The glands in there.
Do you have any pets yourself?
Yes, over the years we've had various animals. At the moment we've got a dog, 40 sheep, a couple of ponies and a snake. It sits in its vivarium on the landing at home, and it's my son's snake, and I think he uses it purposely to terrify some of the young ladies who visit and others, and that my daughter's boyfriend is not at all keen on it and walks round the landing to try and avoid it.
Has it ever escaped?
On one occasion it did escape briefly, but was rapidly recaptured, I hasten to add.
Would you recommend becoming a vet?
Yes, I think that it's been a good life. I certainly have enjoyed it. It's meant it's very challenging, very demanding. You never stop learning. And in fact, you can't stop learning, because medicine, whether it be veterinary medicine or human medicine, the changes are immense over the years. So you're constantly having to be kept up to date by reading, attending lectures, talking to colleagues, and also by your clients, because these days with the internet, they very often will come in with a whole sheaf of papers and say, we think that our dog has got so-and-so. Here you are, Mr. Vet, look at all this information. And you then sort of go, thank you very much, and put it gently to one side and have a look at the animal and decide that this extraordinary disease that they've just found on the internet doesn't have any relation to what's in front of you. But that's one of the challenges of today.